right. Hello, everybody. The Nameless Narcissist here once again. A simple man diagnosed with NPD, talking about pathological narcissism and the things that go on in my head. If you like this video, please like, comment, and subscribe. But keep in mind, I'm no clinician. But we have a clinician here today, so I have credibility now. All right. Mark, would you like to introduce yourself and also maybe give an introduction of how you got interested in like narcissism and stuff like that?
Sure, yeah. So it's going to be a little difficult for me here because my camera is just above the screen, but I also want to look at you. So look at you, right? Or at least your facsimile on my screen. So if my eyes are darting back and forth, that's why. At any rate,
I'm just looking at myself, so it's
there you go, right? Okay, so gives me permission to look at myself too. So thanks.
Exactly.
No, my name is Dr. Mark Eatonson, and I'm a licensed psychologist. Licensed in the states of California and New York, and I have a practice specialty working with pathological narcissism and related issues. I've been doing that for about 10 years or so. I'm also author of a book on the topic called Unmasking Narcissism, a guide to understanding the narcissist in your life, and that's available on Amazon and also at major book retailers like Barnes and Noble and Target and stuff like that. Yeah. I also have a podcast / YouTube channel, and that's called Heal NPD, where I really focus on trying to focus on ways that people can who identify as narcissistic, or people who have someone in their lives who is narcissistic, just trying to kind of increase the amount of aware, like compassionate, empathically sort of informed awareness of this disorder, really not into stigmatizing or over pathologizing narcissism. I'm sure we'll talk about that a little bit. There's more than enough of that out there in the world on the interwebs. So I'm just really about trying to identify and highlight the essential humanity involved in all forms of narcissism, both healthy and adaptive, as well as pathological or sort of at the personality disordered end of the spectrum, severe narcissism.
I want to say too, like his channel, like it gets my stamp of approval, hence why we're actually doing this. I found his channel a while ago. I have his channel linked on my channel. I will also put a link to his channel in the comments. If you want to learn about pathological narcissism, this is the place to go. And his channel is not, well, here too, but like his channel mainly. If you want to hear it from like a clinician's point of view who does treat narcissists, because we don't have very many of those that are speaking about it honestly. So seriously, highly recommend him.
No, I appreciate it. Thanks for the recommendation. And likewise, I've watched some of your videos and done a little bit of research myself on what you've been putting out there, and I think everything that I've seen at least is well informed, and it is often based in the research, the peer-reviewed research, and I just think that you speak on this topic both from an honest and authentic sort of lived experience, as well as kind of appropriately roping in the clinical material as well, the literature. So yeah.
I appreciate that. That's what I always try to do. I'm the best narcissist, as I always say.
Yep.
But I appreciate that as well. Okay, so like obviously like my audience knows me more or less, and I kind of want them to get to know you more than me, just because it's like I don't know, I feel like I'm running out of things to say about narcissism anyway. So how about you give a little bit of, we talked about this before a little bit, but I want to give a brief background of how you got into treating narcissism.
Yeah. So you're right. We just a full disclosure. We kind of had a bit of a discussion before we decided to start recording. So we're kind of revisiting.
This was very impulsive.
Yeah. So when I was in grad school, my very first sort of real patient was narcissistic, and I ended up diagnosing this individual with NPD. It took me a while to realize that's what was going on, and I,
how long did it take you?
Yeah.
Sorry to interject. I'm just really curious.
What's that?
How long did it take you? Because I'm really curious.
Yeah, so I spent a couple of months just kind of fumbling around trying to figure out what was going on in the therapy process, because I could feel this kind of profound sort of dependency, like this undercurrent of emotional dependency from this patient. Like he would hang on my every word. But at the same time, he kept telling me about how he was going to see other therapists and how much more experienced than me they were, and how they one of them made him cry in the first session, and how that really spoke to him. And he could just tell that they were really on top of their game, but I was this sort of feeble beginner. And yet week after week after week he kept coming back. And so I went to my supervisor and I was like, what is this? Why is this happening? How can I understand this? And I ended up spending a lot of time in the school library, and I early on was able to kind of find some really solid clinical material, old school stuff, like.
All right, sorry about that, everybody. We had neither of us are we're both too stingy to buy a full version of Zoom. So I guess we're just going to have a break every 40 minutes.
There you go. Yeah, so I don't remember exactly where I was, but I ended up doing my dissertation on the intersection between attachment and narcissism, and viewing narcissism through the lens of attachment, which was actually very interesting. And I think it turns out somewhat timely. I was actually just reading a recently published book by Glenn Gabbard and Holly, I think Holly is her name, Crisp. Glenn Gabbard is the first one to have identified that there's sort of a grandiose and a vulnerable narcissistic presentation.
Okay.
And anyway, they have a whole chapter on that, the intersection between attachment and narcissism.
Interesting. Very nice.
Yeah, published 10 years after my dissertation. I was like reading it to make sure that they didn't like lift my dissertation.
Did they say?
Yeah. I was like, wait, did I get credited? It turns out that they read the same sources that I did, but anyway,
wow,
it's a good
assholes.
book. It's called Narcissism and Its Discontents.
I'm gonna write that down actually.
Yeah, it's published in 2020. Anyway, I did my dissertation on it, and just spent like 3 years just neck deep in the literature on the topic, and ended up becoming the book that I wrote, sort of that informal / formal education, kind of spun into the book. And I think I told you earlier, offline, that there's something about this pathology that just really speaks to me. I think it's true for every clinician that there's just sort of a corner of human psychology that really kind of resonates for them for whatever reason, and for me, it is something about the wound, the sort of essential neglect, emotional neglect that contributes to pathological narcissism, it is just so quintessentially human, and just it might sound funny to some people, because I think most people conceptualize narcissists as somehow inhuman. But I've
been possessed so many times, you have no idea.
What's that? You've been told you're possessed? Oh my goodness.
Yes, so many times. I'm like, listen, I don't like. I'm like, are autistic people possessed too? I don't think that's the issue here. Yeah. It's so funny.
Yeah. So anyway, so that's my story, and I just, even if I didn't specialize in narcissism, I think I would just naturally gravitate toward the narcissistic sort of woundedness in the people that I ended up working with. So I just decided to go ahead and specialize in the disorder, that's what I do.
Yeah, I think it's a really cool story, honestly, and I'm glad that somebody's sticking up for us. That's for sure. Like, speaking of that though, because I feel like this is kind of whenever I make a video, I feel like this is almost the elephant in the room of what I want to bring up here, and I would love to hear your take on it.
Yeah.
And I'll kind of explain some of my thoughts on it first. But the term narcissistic abuse, which has been sensationalized recently. I've been pretty clear about my gripes with it in some of my videos, because I think it can be helpful to understand pathological motivations or at least manifestations of abuse. But I think obviously the obvious one is like, it implies that all narcissists are abusive, but also it limits how we view abuse. Since there isn't terms for other similar forms of, like, pathological forms of abuse, we are only looking at it as if, like, the only alternative pathological abusive behavior can be narcissism. And, like, there's presentations like paranoid personality disorder and OCPD that can exhibit similar traits, but also have some, if there's certain predispositions there, express those traits, and then that can affect how people can deal with it if they're seeing these people and thinking they're narcissists because of how sensationalized it is. Yeah. But to end it off, I do think at the end of the day, we should be viewing it as, this person is an abuser and they have a pathology that makes them abuse in this way, not this person has a pathology that makes them an abuser, if that makes sense. The National Abuse Hotline puts it really well in terms of abuse is not a flaw in psychology, but a flaw in morals. And I think that the childhoods that cause both those things have a lot of overlap, and hence why people like me can hurt a lot of people, but they aren't intrinsically tied, is kind of my whole take on it.
Yeah, I'm not sure if I heard a question in what you said there, but I think you make
just how I just want to see how you view narcissism.
Oh, how I view it, yeah. So I think I agree that the term narcissism and abuse, those terms are not synonymous, right? But I do think that, okay, so a couple of points I want to make. If you're looking at sort of the spectrum of personality functioning, as you move more toward the severe sort of personality disordered end of that spectrum, I think that, and this is regardless, by the way, of personality disordered category. So I could be talking about histrionic, I could be talking about borderline, I could be talking about antisocial, paranoid, I could be talking about depressive, okay? Any personality disorder, the person will, to a certain extent, blur the boundaries between self and other. Okay, it's part of what makes their kind of orientation toward experience pathological, is that they have a very difficult time sort of seeing and respecting interpersonal boundaries. And so I think that there's, and that lends itself naturally toward exploiting somebody, projecting your feelings onto them, and then sort of treating them accordingly, right? I think that any kind of abuse of the other is enabled by a blurring of those boundaries, right? You don't really see the other person as an other person.
Yeah.
Right? So of course that happens in pathological narcissism as well. Now, I think that there's also in the narcissistic experience this kind of pressure to both eject unwanted parts of the self, to get rid of them, right? And so those are projected onto people, as well as a kind of what we would call entitlement, you know, where you're sort of trying to get from them the sort of positive mirroring that the self needs to perform its regular self-esteem maintenance functions, right?
You have to like me, damn it.
Exactly, right? I don't exist the way that I want to exist unless I see that existence mirrored in your reaction to me, right? So you can see the blurring of the boundaries there.
Yeah.
Right?
Okay. Actually, that was a really good way of putting it, because I always struggle with the idea of like I always struggle with like, okay, what are boundaries? What does it mean when I have flawed boundaries and stuff? And the way that was phrased, I really liked it.
Okay, well, good. Yeah. So I think that there's a way that narcissism over time in a relationship can become sort of a characteristic kind of abuse.
Yes.
Where,
Okay.
like, I keep obliterating your experience and substituting my experience for yours. I keep kind of taking the parts of me that I feel are bad and putting
Yeah.
them on you, right? And so over time, a person can start to feel kind of erased as a separate person.
Interesting. Okay.
And
Yeah.
and so I think that maybe the best phrase for that would be narcissistic abuse.
Okay.
But I want to make it very clear that I don't think that all narcissists are necessarily intrinsically abusive. I don't think that abuse ought to be like the first thing we talk about when we talk about narcissism.
Oh, yes, yes.
And I think that there is a way, and this has to do with the way that it's described in the official kind of diagnostic nomenclature, the DSM and stuff like that. There's a way that the disorder has come to be conceptualized as narcissists cause suffering in other people, but they themselves are not experiencing suffering or distress. And we know that that's not true. We just know it's not true, right? I mean,
Yeah.
NPD is positively correlated with suicide, right? The NPD population is an at-risk population for suicide.
Yes.
And I think and I gave a whole talk on it at a conference once, just because it was on the hidden connection between narcissism and suicide that even clinicians don't recognize.
It's honestly, it's like it's shocking when you kind of think about like, because again, I mentioned the study earlier that I had in my TikTok and some other things, like the fact that in cluster B personality disorders in general and the leading to in suicide were borderline, obviously, and narcissistic. And that 20% stat to me is shocking. And it's kind of amazing to me that like, this isn't more talked about, because imagine any other disease having a mortality rate like that and it not basically being a national crisis. You know what I mean?
Absolutely. But think of it like this too, right? So a lot of those studies, that it depends on how they are identifying narcissists, right? If they're using a scale like the NPI, or they're relying on the person having been diagnosed with NPD. NPD is well, it doesn't tell the whole story, right? It leaves out this whole other dimension, which is about narcissistic vulnerability and hypersensitivity to shame and depression and anxiety. And so there's this whole sort of segment of the population that I feel, if the diagnostic criteria were revised, would probably fall under the heading more readily of pathological narcissism. And then I think you'd see that suicide figure skyrocket.
Wow, really? Like past 20%?
Well, because think about it. I mean, the way that NPD is diagnosed, it only looks at the grandiose factors.
Yeah, good point. Yeah.
So what about somebody who is overtly vulnerable and covertly grandiose, right?
Shit, dude, I'm like, oh God. I'm like, oh man, even more of us are. Oh Jesus, I didn't even think about that. But no, very good point. I didn't even. So like, because basically with diagnostic criteria, you are seeing the most resilient of the people. Like those defenses are so entrenched that they aren't suffering. But at least, I mean, obviously, clinicians who know what they're doing with NPD aren't going to diagnose purely off of the DSM criteria like that. But I'm sure there are a lot that do.
No, yeah, I don't really ever refer to the diagnostic unless it's to criticize them.
That's funny.
Yeah, well, I mean, and even the DSM is aware of this, right? I mean, even the task force, that put together the DSM-5 and the DSM.
They almost took it out.
They almost took it out, and then they put together like a special committee to come up with an alternative list of criteria.
Okay, so I watched a presentation once on one of the people who were part of that task force, and they said that at like the last minute, it was basically vetoed by like the people at the top. Do you know the specifics about why the alternative model wasn't actually put in the DSM like proper?
I don't. I don't know that story, but I do know that. Well, this is the problem with psychological diagnosis to begin with, is that it's decided by committee, right? It's a committee of psychiatrists who get together and they refer to the relevant literature, and then they make a decision. You know, should this criteria be included? Should this diagnosis be included? Should it be revised? Should it be taken out altogether? And the problem with NPD in particular is that it's a feedback loop, right? Because most 77% of research on NPD has used an instrument called the NPI, the Narcissistic Personality Inventory, and that inventory was put together using the DSM, right? So
wait, do you mean the other way around? That DSM
no. I mean, so look, in the late 80s, they made the DSM-3 TR, the text revision, or the DSM-3R, I think is what it's called. Anyway, it was a revision of the DSM-3. The DSM-3 had the original diagnostic criteria for NPD, which was based on the psychoanalytic tradition. So it talked about, deficits in the self. Right?
Yeah, I actually, because of one of your videos, I actually read those criteria, and they were way better than the DSM-5 criteria.
Well, it describes a whole person, right?
Yeah.
It describes a comprehensible picture of psychopathology and not just a collection of like unlikable traits.
Yeah, exactly. Like the reliance on external, like observable traits to diagnose, one of the worst limitations of personality disorders in the DSM.
Absolutely, and it is mostly for NPD that's the case, and it's because because in the mid 80s, the field of psychiatry got self-conscious, and they decided, hey, wait, we don't want to be, perceived only as psychoanalysts here, right? So they took out any mention of the dynamic unconscious and whatever else, right? Mm-hmm. And they tried to make the NPD diagnosis just about observable traits. But what they inadvertently did in the process is cut away half of the disorder.
Yeah. And
they made the half that remains incomprehensible to people.
Oh, yes. Oh, yes. I mean, in my entire life, I don't think I've met somebody who matched all of who was an archetype of those diagnostic criteria in the DSM and didn't have like that flip vulnerable side.
Yeah.
You know what I mean? Like that'd be an unpleasant person.
That a person would be just, I mean, it is essentially just an asshole.
Exactly.
Right?
It's the asshole disorder.
Yeah, it's the asshole disorder. And so then the team that did the NPI, that measure, they were like, okay, we're going to look at the NPD criteria and we're going to make an assessment. So that's what they did. And now that assessment is used to inform subsequent editions of the DSM, because 77% of research on narcissism uses the NPI. So it's this crazy feedback loop that just preserves this ultra stigmatized kind of dehumanized portrait of a disorder that is actually based in fundamentally in an experience of shame and alienation and feeling like you're not somehow a human.
That is like, so like I always kind of say that like nobody fucking knows what they're doing half the time, even in academia, and just stories like that just really entrench that mindset that might be a little unhealthy for me to have. And it's like, holy shit, like that's so crazy that almost all of the research on pathological narcissism is based on misinformation effectively.
That has been changing in the last 10 years, thankfully. There's a guy named Aaron Pincus. I think his first name is Aaron. Last name is Pincus.
I'm not sure I heard of him.
Yeah, he's over in Philadelphia, and he and his team have produced some great work, just kind of trying to highlight the vulnerable dimension of narcissism. They've developed the pathological narcissism inventory, the PN.
I love that. Yes, that's a really good test for narcissism. 100%.
Yeah, absolutely. And I feel like that's like finally the course has been righted. But we've got 30, 40 years of kind of skewed, kind of bad data that
bullshit.
yeah, essentially.
One second, I'm writing something down. Oh my god. No, like, oh my god, that's so fucking well. But at least see, like, because I have seen a recent trend in the literature, which hopefully will eventually bleed into the public, where like there is, like, I've read a bunch of studies now referring to the fluctuations between grandiose and vulnerable narcissism. Like there was this one study, what was it called? Well, a really interesting study was the nonlinear relationship between grandiose and vulnerable narcissism, which basically showed that grandiose and vulnerable narcissistic traits were uncorrelated up until you hit like the 70th percentile of grandiosity. And then they were very highly correlated. And I think that could be a good cutoff in terms of what is a narcissist versus pathologically narcissistic. But which is interesting. I do have another, so obviously I reference this study on my channel a lot that shows that 53% of people who are in treatment for narcissistic personality disorder over a 2-year treatment period go into remission. And I think it would be even higher if it were for the fact that they were able to get a hold of some of the other people that were in the study, but they just counted those people as non-remission if they can't get in contact with them. And I want to point out that the trait the most likely to go into remission was interpersonal exploitation. So I want to hear your experiences in treating NPD and what you think that rate might be, like what it is in your practice.
Yeah, well, I don't use measures like that, so I wouldn't be able to give you, like hard data. My approach is really about trying to integrate inside of the person, help them to integrate their kind of their experiences of grandiosity and shame, of right, because that's really what the partly the disorder is about, right? Is this kind of this splitting off of unwanted experiences and it becomes this constellation in this kind of wounded or bad self, image that's kept somewhere inside the psyche.
Very briefly, because this is something I've always kind of experienced. I just want to touch on this for a second because I've been really curious. Do you see a lot of narcissistic patients who have like an innate feeling of like badness, like they are bad people?
Oh yeah. Because
that's something I experienced a lot, and I didn't realize that was as tied to my NPD as I thought it was.
Yeah. So I think so this is splitting, right?
Yes.
Or we could also call this discontinuity of experience. Okay? Yeah. So one way to think about sort of mental health is that the person kind of, regardless of where they are and what they're doing, they have this kind of cohesive experience of self, right? I'm the same person today that I was yesterday, that I was last week, that I was last year. And regardless of what life throws at me, I'm going to kind of respond in a way that kind of has an internal logic to it, right? But when the self is sort of damaged or there are deficits, in order to kind of protect, and ultimately this is about protecting the ability to have good feelings. Okay, so early on, and we're talking very early on, maybe even before like the person learns to talk, there's this process set in motion where bad experience is cut off and sort of separated subjectively and put in a container over here in order to protect the kind of fleeting good experiences that happen, right? That are maybe kind of few and far between. because otherwise all the bad experience threatens to take over the good experience. So they have to be kept separate, right? But what this turns into in the adult personality is discontinuity between these two containers and a kind of flip-flopping between the grandiose self and the vulnerable self, right? The bad self, you know?
I can flip-flop between grandiose and vulnerability like a couple times in a day, even, depending on like what's going on in my life and shit.
Yeah, what's often why this disorder, narcissism, is mistaken for bipolar disorder. Mm-hmm. Because there's this flip-flopping, right? And feelings of depression and worthlessness and shame and humiliation and badness live over here, and feelings of grandiosity and perfection and I'm the best there ever was and you're the best there ever was. Together we're the best that ever was, right? Live over here,
including people my grandiosity, basically.
Exactly. Yeah.
Congratulations on grandiosity right now.
Idealizing and devaluing, right? Mm-hmm. Yeah. You idealize yourself, you idealize others, you devalue the self, you devalue others. And when you're over here, I'm not talking about you personally, but when one is over here in the devalued place, you kind of can't get back to the grandiose place, like at will. So it's like when you're over here, it's like being on different islands with their own ecosystem. And you kind of can't remember what it's like over here, but you know you need to get back there somehow.
Yes. Oh my God,
that
yes.
becomes pressure, that in intrapsychic pressure and interpersonal pressure too.
Yeah. Something I also noticed with grandiosity was is that even when I'm in a grandiose state, there's like a little bit of an anxiety there of that I'm going to lose that soon and go back to the other island, so to speak.
Yeah.
It's never like, I'm never completely like, how do I put it? I would say I'm never completely like content in my grandiosity. And then if I achieve something that does make it grandiose, there's just like this fear of like, what if I can never achieve something like that again? What if I never get back to this point?
It's fundamentally insecure, like, and you have a sense that it is too. You have to keep working to sort of stay there. Like I shared this story with you earlier, kind of offline, but the story of the person who's phobic of flying in the plane, and they feel like they need to, it's up to them to keep the plane in the air by worrying about it, you know?
Yes. Mm-hmm.
You have this sense that if you're not careful, you'll lose it and end up back over here. And that's just the worst thing ever, you know?
Oh my God, yes, that that resonates so much with me. Holy crap. Just that. Oh my God. And I brought this, when we discussed that, I brought this back to this this need to want people to be dependent on me or to kind of control them in ways to kind of like ensure that, one, I was getting that validation stuff that I needed, and a fear that if I didn't, they'd leave me. Because those are both very to me, those are both very intrinsically tied at a lot of levels.
Well,
but yeah,
at
we got
base,
sorry.
Yeah, I just want to say real quick, at its base, you know, it's about being good enough to have love, to be affiliated with other people. Mm-hmm. I think I hear this experience often from folks that I work with, this experience of being othered or outside the human experience somehow. Like one patient shared with me this feeling of being like outside a window on a cold night looking in at like a warm family, you know, like in front of the fire, and just there's just some way that they just kind of don't belong.
Yeah. Oh my God. Like because I always say to people, like, even before I was diagnosed, I knew something was kind of off. I knew I couldn't connect to anybody. I would look at people and they would just be like so relaxed and like happy and stuff like that. And I would just be like, why can't I get there? It was so it's frustrating. It really is. And it's distressing. Even back then, before I was diagnosed, it was very distressing to feel like that all the time. Yeah. And which is not, again, now that I made like my community and stuff, and I know people like it, I do feel a little bit, that has been alleviated a little bit, that I know that there's other people, because logically I knew there's other people like me, but it was a completely different experience from like interacting with people that were like me, if that makes sense.
Well, I think, you know, I think I said something like this in the most recent video that I put up on my channel, but, you know, we discover the self in relationship with other people, right? Mm-hmm. Others are the mirror of self-experience in a way. You know, when anybody who's spent any time around small children who are very actively building a self, they're constantly coming up. Look what I did. Look what I am. Look what I'm doing, right? And the function of the caregiver is to be like, oh, look at that. Oh, you made a this. Oh, you drew a that. Oh, are you sad? Oh, did you get hurt? Oh, are you happy? Right? And then the kid is like, yes, that resonates with what I'm feeling. That is what I am feeling. And that's how a self is built.
Yeah.
If that mirroring function is lacking, maybe the parent is preoccupied in some way, or using the child as a narcissistic extension of themselves, then the child, there's a deficit there that develops and has to be compensated for, right? And the compensation is often takes the form of this kind of grandiose striving.
100%. I always sorry, I have a nicotine addiction. I always say that I'd mentioned this in a okay, I'm gonna be honest, that comment that I wrote, it was a little bit despondent. I was a little drunk, whatever. But I always described it as like, it does feel like I kind of died as a child and I just kind of have this shell left.
Oh, right. Yeah.
And it's very, very distressing, I'll say, to feel like that. It's something that I wish I could like express better to people on my channel and stuff, the level of distress that I do, even if I'm not showing it like right now. It sucks that I can't. Sorry, what's up?
I'm getting another one of these meetings. Will end in 10 minutes.
All right. Oh my gosh. This is gonna be a long.
Yeah, but I want you to, if you would, just complete that thought, and then we'll.
Oh fuck! What was I saying?
You want to. It's hard to express the depth of the loss, of the pain.
Yes, it really is. Like every now and then I'll say something like that, like people are like, whoa. Like I mentioned in one of my videos recently that like I literally have thrown up from shame before. And that's how intensely I can feel it at certain points. And people were like, oh my gosh, that's like, I had no idea it could be that affecting. And it's like, yes, this is why it's a disorder.
Yeah.
But it sucks. Okay, let's go to the other chat room so that we don't get kicked off.
Okay.
Okay, we're back again. So something
let this be a lesson to everybody to go ahead and purchase that
buy Zoom
for Zoom if you're going to collaborate.
By the way, this video is sponsored by. Okay, so remission, MPD, how you viewed how many of your narcissistic patients like recover, all that.
Yeah, so I don't really see it as like recover versus like unrecovered. So I view personality functioning as a continuum. And I think we move around on the continuum depending on events in our lives, the amount of stress that we're under, stuff like that. But I also think that there's kind of this underlying foundation, right, of ability or resources, organization, essentially, in the personality that sort of defines the range of movement. Okay, so somebody who's more at the healthy end of the personality continuum, if they undergo some kind of huge life stressor, they might slide back in terms of their coping ability, right? Regress to a certain extent to a more robust set of skills that they developed earlier in life for negotiating stress. Okay, but they're not going to slide too far back. Okay, their functioning is not going to be too compromised. Right. So they might slide from the healthy to maybe what we would call the neurotic range of functioning. Okay, where they're more anxious, they're more prone to things like anxiety and panic attacks. Their level of interpersonal dependency goes up. Their sense that the world isn't sort of a safe and stable place, starts to kind of dominate a little bit more. Right. But somebody who's maybe dispositionally in the neurotic range of functioning, if life really throws some shit at them, might slide into what we would call the borderline range of functioning, right? Where their kind of grip on reality starts to get a little bit shaky. And they start to do things like engage more actively in splitting behaviors, in kind of that, blurring of the boundary between self and other. Somebody who's at the borderline range and life throws some shit at them, they might slide into the psychotic range, where they sort of lose the ability to kind of cope with the demands of reality. So that's kind of the continuum. Okay. So if I'm working with somebody who's in the borderline range most of the time, then I would view progress as them starting to kind of be able to recognize and tolerate me as a separate other in the room. I would find myself doing less of what we would call just witnessing or mirroring, and being kind of allowed to insert my own thoughts, feelings, and impressions more actively in the room. Somebody's at the neurotic range, I would be looking for less anxiety, less attachment anxiety, and more kind of a feeling that, they're kind of able to weather the storms of experience without too much anxiety. Yeah, I don't know if that makes sense, but I'm not really looking at, like, it's not like an either or. It's not you're narcissistic and then you're not. It's kind of like, once, like, people who are narcissistic, they're just narcissists. Like, they will always have that personality style. The question is, how severely are they warping reality? How extensively are they blurring the line between self and other? How much are they keeping parts of their experience separate in their own head?
So how like, if somebody goes into, let's say I went into treatment, I mean, I'm in treatment, but if I went into treatment freshly, how likely do you think it would be that I wouldn't go into the neurotic range if I was at the borderline level of function?
Yeah, sure. Well, I think it's so. What was I going to say? Somebody who comes in and they're heavily defended, that's going to take longer than somebody who's kind of falling apart.
Yeah. Oh, interesting. Okay.
Yeah. Somebody who's heavily defended you're going to keep coming up against this sort of wall, this invisible barrier. And the problem is they don't really see the need to dismantle that wall necessarily, because they're so defended. So sometimes you're just kind of waiting around for life to kind of take a few swings, and then you can kind of jump on.
Life will fall apart eventually. Then I can treat them.
Yeah, it's something like that. Yeah, I mean, it's because narcissistic defenses they can be very strong, so strong, in fact, that the disorder can sort of be invisible to the person and to other people. In fact, we call that the false self, compensatory self defense. It can be very convincing, right? So, let's just take somebody who's having a hard time, and maybe they're at kind of the borderline range, and how likely would they be to go up to neurotic? I think I would say close to 100% if we stay in therapy long enough, we stay at it long enough, and they're motivated, and right? Because I see narcissism as a disorder that's defined by deficits, really, and then the ways of compensating for those deficits. So when there's deficits, we try to kind of provide the types of experiences that will help to fill in those gaps. And I see human psychology as inherently growth oriented. Like, I think we're all this is Carl Rogers, the founder of humanistic psychology. But he described humans as like little potato plants in the basement that are like growing toward the light, right? The little window up at the top. And along the path, they get tied up in knots, they get wound around shelving and whatever else, but they're always growing toward the light in whatever way they see is available to them. So I think we just try to like set the right circumstances and let that kind of inherent growth propensity do the rest.
I really like that. That's beautiful, honestly. I like that. That's cool. And honestly, like exactly what I wanted to hear. I was like a little worried. I was like, oh man, what if he says like 25%? But
it's a roll of the dice, really. I mean, it's 50-50. I don't, yeah, no.
I don't know what the fuck I'm doing. They just kind of walk in. And
Some
shit happens. Okay. So
you keep paying me, so I just keep sitting there, you know.
Oh, that's funny. Okay. So I have a couple more points because I feel like this video is going to be really long. So I'm going to try to I'm going to limit myself now because I keep writing more shit down. Be like, oh my God, that's a good thing to talk about. I'll stop doing that now. And I think I have 3 or 4 that I want to touch on. I mentioned transient
people, so that, you know, hopefully.
Well, I would love to do it again at some point too, honestly. But transient psychosis and NPD, I mentioned this a little bit earlier because I knew that was a diagnostic criteria in the DSM-3.
Yeah.
And one of my viewers have been asking about that a lot, and you're welcome. I'm finally getting around to giving you some info on that. And I would love to hear like how you observed it, how that manifests, et cetera, et cetera.
Yeah, so, well, just from a diagnostic perspective, so the DSM-3, like I said, was more heavily steeped in the psychoanalytic tradition. Okay. And that continuum that I just described from psychosis to healthy functioning, that is a psychoanalytic concept.
Yes.
So it makes sense then that in an early edition of the DSM, one of the diagnostic criteria for essentially a borderline level disorder. Okay, that's what if you have a personality disorder, you're in the borderline range of functioning. Okay, which is different than BPD, and I've got a video about that on my channel, and if anybody wants to watch it,
it's very confusing for a lot of people, but yeah.
Yeah. So if you're in the borderline range of functioning, it is common to have transient psychotic episodes.
Interesting.
Not common, but it's not unheard of.
It happens though.
Yeah.
Is that how do I put it? Is that for all personality disorders that can fall within the borderline range?
Yeah. Yes. Yeah, because the thing that so think about it in terms of development, right? Mm-hmm. The first task is to sort of come to terms with the constraints of reality. Okay, just because I want. I'm going way back now. I'm speaking heavily in psychoanalytic terms, okay? Just because I want the breast to appear as a baby doesn't mean that it will, right? And so kind of that is the first like trauma, right? Inflicted by the world on the infant psyche, and then a series of defenses and coping skills have to sort of be created to negotiate that. Right? Once that happens, now the big challenge is the difference between self and other, right? Just because I'm mad at you doesn't mean you're bad. Just because I'm sad doesn't mean that you intended to hurt me.
Yeah, that's something I still struggle with. Like I made a metaphor with it. It's like if 2 people are around, and if like I'm around somebody and for whatever reason a brick lands on my foot, it's hard to not assume that person intentionally dropped the brick on my foot.
Absolutely, yeah. I mean, and the specters of this, you know, they come up even in like really healthy psychologies, right? I mean, you know, something lands on your foot and you're like, God damn, you know, and it's like, and you know, so that's the borderline range. That challenge of recognizing the difference on an unconscious fundamental level between self and other, that's the borderline challenge. Okay, then once that's negotiated, now the big problem becomes, how do I keep from destroying the people on whom I depend, right, with my own destructive impulses? And that's the neurotic range. Okay, so it's like, that's the big challenge there, right? Just because I'm mad at you doesn't mean that you're going to go away forever. Just because I hurt you doesn't mean that you cease to exist, right? Because once you realize that other people are other people, you can't magically create or destroy them at a whim. Yeah. Now you're dependent. Now that's a big problem, right? You got to worry about preserving your objects.
See, it's so interesting to me when you say it like that, because it's like, I know that I lack, like, what is it? Like, is it object constancy? And I really struggle to, whenever if I know somebody's mad at me, I can't understand that they have, like, that's just one part of me on a whole history of positive experiences. When they're mad at me like that, I'm like, all right, friendship's probably over. Fuck my life.
Right. Yeah, that you kind of end up in that kind of bad container over there.
Yes.
Yeah, so I forget what you had asked me though. There was a
question. Transient psychosis.
Oh, transient psychosis. Yeah. So it's just a sliding. It's a regression. Okay. So if you're at the border, if you're in the borderline range and life becomes overwhelming, there's a tendency to regress back to the last sort of successfully negotiated developmental stage.
Okay, that's an interesting way to conceptualize it.
Yeah, yeah.
So that's really interesting. I like it. So it's like basically how it's viewed, at least in psychoanalytic stuff, that like basically you're going through defenses backwards and backwards until something works, depending on your life situations.
Yeah.
Because it's funny because I kind of talked about this, like not in my own words, in my experience, I guess, but I always hear people be like, oh, the narcissist was masking because he was really nice at first and now he's an abuser or whatever. And I'm like, well, one, like the masking is all pervasive, right? You can't, it's not going to be just masking abuse. Also but I was like, okay, what happens if like the narcissist mask, quote unquote, does fall off? And for me, a lot of people think that's anger. No, that's like the last layer of the mask to me. When I think of it, when it's like completely off, I have this memory where I was at my girlfriend's apartment at the time, my ex-girlfriend now, shout out M. I was like drinking a little bit and I got into like this horrible headspace. And this is one of the times that I threw up from shame. I was able to blame it on the alcohol to her, but I was barely even feeling it. And I was just sobbing, saying that I was like broken and defective or something like that, and like yelling at her. And that to me is when that, like, those defenses are all gone. It's not anger. It's just a complete, like falling apart as a person. Does that make sense?
Loss of self. Yeah. You lose yourself and then you're you just in free fall.
Yeah, exactly. That wasn't pleasant.
No. And we all have been through it.
Mm-hmm.
We've all been there. But ideally, that kind of fragmentation, that falling apart of the self, only really happens in early childhood. And our caregiving environment, our caretaking environment, helps to kind of put us back together. And that experience becomes the glue that holds the self together and makes it more resilient through adverse experiences later in life. But if that helping kind of get put back together never really happened, then the self remains vulnerable to repeated fragmentation throughout life.
Yeah.
Right.
Hence hypersensitivity to criticism.
Yes. Yeah. And then you start to become phobic of it, hypersensitive to it, to the conditions that create it. Right. Just like, I remember as a kid, like getting a shot, right? Like a vaccine, like a booster shot, and just had to happen once. And then I was like forever terrified of going back to the doctor.
Yeah.
Right? Because I didn't want to get another shot. So I think the hypersensitivity to criticism is really about, I don't want to fall apart again. It's the worst experience imaginable. I completely lose all sense of safety in the world and all sense of being a cohesive self. So don't fucking criticize me. Right? You know what I mean? But you can see how that develops.
Yes.
Yeah.
It's like, I mean, well, because like it's so often too, it's that like, like you criticize me and I'm in my head, I'm thinking, you knew that would hurt me, so that's your fault that you did that.
Right.
And that's what it always feels like whenever I am criticized, and hence why I have kind of visceral reaction. It's like and it's externalizing emotions, obviously, but it's like you caused this pain, so why should I not punish you, more or less? Like that vindictiveness. And honestly, it's become a huge issue with being a public figure in quotes now, because I am constantly getting criticism. And me and Tess were talking about this actually. There's days that both of us have spent like entire days like staring at our like TikTok comments and like just getting into arguments with people. It sucks needing other people like you.
Well, but I'll just put it out there that I think, so I put this video on Reddit. It's like a 4-minute video about just like, hey, people have a misconception about what narcissism is. And I did not anticipate that anybody would even notice it really. And if they did,
Yeah.
I think it would be controversial. I don't know why. That was kind of stupid to me. And then, like, just people, yeah, people were just like, "How dare you!" And it got under my skin. I remember just sitting there for hours and like freaking out because I was like, "Oh my God, like my real name is attached to this, and like
Yeah.
people are like gonna like burn me in effigy, because of what I've said here." And what I said, all I did was literally look up peer-reviewed articles and quote them. The definitions that appear on the screen are quotes from peer-reviewed journals, right? And people are losing their minds over this. I'm just like, and I get it.
Oh my God.
People get hurt and they're looking for answers, and I get that. But there is this kind of feeding frenzy right now around this kind of straw man, boogeyman caricature of what narcissism supposedly is. And I got to tell you, it's just not accurate. I mean, it's just not reality. That piece of it. It's not that their pain isn't real, and it's not that they weren't really hurt by a real person.
Yes.
Like, that's all valid. And I'm not gonna, I wouldn't dare to like presume to know something about somebody else's experience that way. But I do know something about narcissism. And while sometimes it can manifest as this like really ugly, abusive character, most of the narcissists that I've worked with are like, they're like children on the inside. I mean, there's a neglected child on the inside that's hurting, and they're not out to like manipulate and like they're not these like hungry predators. They're starving people, and they're trying to get food, and the food is in the form of like, please see me, please validate that I exist, please let me know that I'm not going to fall apart in the next
tell me I'm real, please.
Basically, yeah. And sometimes that shows up in an entitled way, but the entitlement is to compensate for the vulnerability.
Yeah. It's right? Like, I deserve this, and that's not, at that point I don't have to be ashamed for like needing somebody effectively if I deserve it. Yeah. That, like, you phrasing it like that, well, because that was a realization I just made right now. It's like, oh man, I do that. Fuck. I love that when I have to my videos where I'm like, oh my God, I just had an insight. I gotta make a video on that now.
Yeah, well, I mean, you're well positioned to do it. I'm glad for your channel, because I think that putting a human face to some of these experiences,
With the most one.
but I mean, it makes sense, right? Because that's hiding the self is a part of that experience.
It's I actually meant to mention, like, this is really weird, and like I'm not even sure if this is really a narcissist thing or not, but like when I was a kid, whenever I would see, like, I was going through one of my old photo albums and I noticed, well, middle school yearbook, I noticed that I, for some reason, crossed out the eyes on all the pictures of myself when I was a kid. And I was like, oh, that was weird. But I've always related so much more to like depictions of me where like my eyes are like kind of obscured. Like I once wanted to get a portrait. Well, like I tried to get one of my friends like make a painting that was like for me to express my internal experience, and I wanted them to cross out the eyes. And it was like, and like it makes sense now that I've done some research because I'm always avoiding being seen that I'm ashamed or hurt or whatever. And people with cluster B disorders, we're really good at reading emotions in people's eyes compared to general populations. And so, I don't know, I just thought that was interesting in relation to that.
Well, I think maybe you could see some piece of your experience in your eyes that you're not sure you want other people to see, and maybe you're not sure it should even exist.
Yeah. It's a narcissistic stare, as they say. No.
Well, I think it's shame. I mean, I don't want to like get we're not doing therapy here, but
are you sure?
Yeah, I don't know, but I
free session.
I would when I hear that, I think about shame. I think about seeing in the self some piece of experience that's wrapped in shame and wanting to obscure that.
Because fuck shame. I hate it. Anyways, I have, oh, my next one. Basically, so I have a couple clinicians who watch my content and they're like, oh, it's really helpful, blah, blah. And I'm like, well, first I'm like, man, you guys are supposed to be helping me. What the fuck? But for those people who are like trying to get better at treating like narcissistic patients and stuff, do you have any like tips for them?
Yeah, so I do have a video about this on my channel.
Oh yeah, your most recent one that isn't. Yeah, go check out that video, guys.
I think it's called Treatment for Pathological Narcissism from a Psychodynamic Perspective.
Oh yeah, yeah.
Yeah, which I think I told you I got into some trouble for posting that video on Reddit, and I posted it in the wrong forum, and people thought I was advertising my services, which I think makes sense. I could see it from that perspective, but
yeah,
it wasn't my intention. It was just
what form did you post it in?
So I didn't realize yet that the NPD forum was really what that community is about. And so I thought, well, I'm making a video about how to do therapy for NPD. I'm going to put it in the NPD forum. And anyway, the video talks about some of the challenges in working with narcissistic patients, and some of really it comes down to the pushes and pulls between the therapist and the patient, because the patient will inevitably challenge the therapist's own narcissism, right? Because the narcissistic patient is very inwardly focused.
Yes.
And it tends to leave the therapist feeling like they just aren't helpful. But what's invisible there, what's sort of masked there, is how much the patient is kind of hanging on every minuscule reaction of the therapist. And so that piece of it, if you're not careful, can fly under the radar, and the kind of uninformed therapist will end up acting out. Like, hey, I don't feel like you're invested in this therapy, or I don't feel, whatever it is, basically attacking the patient because the therapist has been narcissistically wounded. And
I actually got a therapist that cursed at me once.
Okay, well, then I guess, yeah, so you've lived it. I mean, I'd be interested to hear that story, because that sounds awful and also fascinating.
It was honestly like, I don't remember what I said exactly. I said something that was like I basically just kind of was like, no, that whatever you just said was dumb, more or less. And she was just like, God fucking damn it, Jacob. And I was like, Jesus. I kind of felt good though that I got that reaction out of her, not going to lie. But yeah, it was so obvious towards the beginning, looking back on it, how she was almost on edge, I want to say. And nowadays she says that like, she always knew that like something, like she didn't know what it was, but like something just wasn't like matching up, which I'm not sure if I believe her or not. But yeah, it was a weird situation, that's for sure.
Yeah, well, and I'm not immune to those pushes and pulls either. I've been in some sticky situations, where there was a provocation of some kind, and I'm a person too. I've been in like an actual argument with a patient once, and then after the fact was like, oh my God, what was that? Like, how did that happen? So I guess what I would put out there is, if you're a patient and you're in therapy and the therapist does something, anything that you don't like, or that doesn't feel right, or it feels like they missed the mark somehow, or they attacked you somehow, or retaliated in some way, just realize that that's human relationships, right? And the beauty of psychotherapy is that this is a special kind of relationship where you can hopefully tell the therapist about what happened, and then the two of you can kind of be curious about it together, and try to figure out, like, well, what was going on there? What was I feeling? What was I did I get lost in my own assumptions? Did I not see you in a way that maybe you need to be seen? And was that actually a recapitulation of the early sort of trauma that led to these problems to begin with? Right? And in acknowledging that together, can we actually like make a repair, and in some ways start to heal some of the hurt that lives there?
I like that a lot. That's great. Oh man, this is a great conversation. Holy shit. I am like I'm getting just like hypnotized by it. All right. Let's see. I think because how long has this been going on? Because I want to make sure it's before the Zoom call ends again.
We have until 11:15.
11:15. Oh, god damn it. What time is it now?
11:07.
Okay, then I feel like this will be kind of a quick one then. Oh, if you had to redo the diagnostic criteria, how would you do it?
Oh, well, I feel like the alternative diagnostic criteria in the DSM-5, and I know that there's a DSM-5 text revision now. There's like a and I will admit that I have not yet purchased it. I don't know what it says.
I know without, if I'm being honest.
Yeah. It just came out a few months ago or whatever, and I just haven't done it yet.
Oh wait, okay. I think I actually went to that one. I don't think it changed any of the diagnostic criteria for.
Okay, yeah. I think I looked up whether it changed the criteria for NPD, but I don't know what it did with the alternative description.
Oh yeah.
The alternative description in the DSM-5 at least is pretty good. I think it's fair. I think it kind of loops in the vulnerability, the subjective distress of the disorder, the mental illness part of the disorder, without sacrificing, the some of the key factors like interpersonal exploitation, right, or exploitativeness. I mean, that is a key facet of NPD. Yeah. Whether you're grandiose or vulnerable, somebody who's in a very vulnerable state is still very kind of interpersonally like a sponge, like just give me what I need. I would say
in vulnerable states, I am more likely to be like interpersonally exploitative because I am in more need of like that validation and everything.
Yeah. And so, but it has that, it does a pretty good job balancing those out. I think also a diagnostic criteria that was maybe more based on the components of the PNI, the pathological narcissism inventory, would be fine too. That focuses on things like hiding the self, but it also has grandiosity and exploitativeness, self-sacrificing, self-enhancement, idealizing and devaluing, stuff like that. But it just has to. Whatever the criteria, it has to be comprehensible.
Yes.
It can't just be a strutting peacock. It can't be Gaston from Beauty and the Beast. I mean, that is an extreme version of NPD, but it's not the full tapestry, Yeah.
So. Yeah, like all of that. So, that's so good. I love that. I do agree though. The alternative model is like so much better. It really sucks that didn't just get put into the primary DSM.
Hopefully it will. I mean, hopefully it will be increased.
It will.
I gotta tell you, in the literature and like the journals about this, where this is discussed, it is increasingly like the chorus of voices, of critical voices, is growing quite a bit in the last 10, 15 years. And so I don't think that we're going to see the kind of classic NPD diagnostic criteria survive too much longer.
Good. Thank God.
Yeah.
Well, okay. I think that's a good note to end it off on then. That, hey, guys, there's some kind of hope to get more accurate information out there, right? But okay. Anyways, thank you, Doc.
Well, hey, I gotta tell you, this has been my pleasure. And keep up the good work. And if I gotta say to your watchers, your viewers, if they're interested, my channel is called Heal NPD, and I don't put out as much content, but I try to talk about this stuff from maybe the clinical perspective a little bit more. I just feel like the more people we can get talking about narcissists as human beings, not like, and I'm not saying erase the bad stuff. I'm just saying I'm not
a good person, but I'm a person.
Everybody's a person, So let's try not to throw the baby out with the bathwater.
Not yet, anyway.
Yeah.
But yeah, okay. Seriously, this has been great. I would love to do something again at some point.
Yeah.
But for everybody else, thank you for watching. Go check out his channel. The link will be in the description. Well, I'll put it in the comments. I'll pin it. And take your fucking meds. Have a good day.
All right. Thanks a lot.
Oh, yeah. Bye. Yeah, you can just end the recording here. I'll probably cut this part out. Oh, man.